Good day, everyone. My name is Anna Marie Agiting, BSN 1C student. Today, I'm gonna show you how to do the health history assessment. So, what is health history assessment? Health history assessment in interviewing clients is a conversation with or questioning of a client conducted for assessing his or her condition. So, the purpose is to assess the client's needs, to collect enough information to help solve the client's problem, and to show the client that you care and have the ability to help him. The materials and equipment are paper and pen. Next is the procedure, which is the assessment. Review available client's information, identify psychological or sociological factors that may interfere with process, and assess client's current sensory or neurological status to avoid complication and the background of the client, and also to know the condition of the client. Next is the planning. Determine assistance needed to know if the patient is efficient to follow the procedure. Next is the planning for the interview should include these key steps. Know what you want in a client before you interview. Plan a set of standard questions for the client. Plan to ask each client of all your basic questions. This consistent approach is important for this reason. It helps you remember of all questions. It is also too easy to forget important questions, especially when you're interviewing several clients. It is important in this procedure to avoid cutting of the questions, to know the important details, and to avoid disorientation of the client. Next is the plan question for individual clients. Here how to frame productive interview questions. Ask open-ended questions. To the client must share what they feel. Prove for additional details. Use reflecting to get more information and present a scenario in order to get more about information of the clients and to have a good information. Next is the implementation.
So, good morning, ma'am. Today I'm going to interview you about your symptoms. What is your disease? So, what is your name?
Janine de la Serna,
How old are you?
21.
After we grade our client, next is explain the procedure, provide privacy, sit facing client, determine whether client is able to proceed in order to have the trust and coordination of the client and to know what the nurse should do to the patient and to ensure that the client is comfortable while proceeding the procedure. Next is the working phase. Keep on focus, seek chronological account, observe nonverbal cues for each symptom, determine onset, precipitating factors, quality of characteristic, region, severity, and timing, clarify absence of other symptoms, identify past hospitalization, identify OTC, medication use regularly, identify other prescribed medication use, identify risk factors, continue with other areas of interest or concern. Next is the termination phase. Provide client with idea that interview is nearly finished and summarize your understanding of client's health concern. Next is the evaluation. Ask client if adequate opportunity was provided to describe concern, to ensure that the client satisfied with the questions, determine congruence of verbal and nonverbal communication, identify unexpected outcomes and intervene as necessary, record and report intervention and client's response, to motivate the clients if there are findings and the result, and to have the data purpose and evidence if there is a possibility to have error. Last is the documentation. Record and report the procedure done, the assessment data gathered and the patient's response to have the legal purpose and documentation that been collected. That's all and thank you for watching.